for Day. Good morning. The Committee on Health and Human Services, Health Insurance Reform, Economic Development, and Senior Citizens now convenes this public hearing and confirmation hearing. Hearing notices were given to the media. First notice on Wednesday, March 5th, 2014, and second notice on Tuesday, March 11th. For the record, today's Thursday, March 13th, and the time now is 9:03 a.m. The committee will hear and accept testimonies, both oral and written, on the following: Bill 275-32, an act to ensure the sanctity of the medical peer review process of the Guam Memorial Hospital Authority, and the confirmation hearing on the executive appointment of Mr. Valentino G. Perez as a general member of the Guam Memorial Hospital Board of Trustees. I'd like to acknowledge the senators who are present with me this morning. To my left, Senator Brent McCready. Thank you, Senator. And Senator Frank Uggan Jr. Thank you very much for joining me this morning. We'll go ahead and start off with Bill 275-32. It is an act to ensure the sanctity of the medical peer review process of the Guam Memorial Hospital Authority by amending subsection N of subsection 80-109, Chapter 80, Title 10, Guam Code Annotated. And what this is really, to briefly explain, is a result of a series of oversight hearings that were committed by the committee during the last term. And so it is the intent of this bill to ensure that the sanctity and integrity of the Guam Memorial Hospital Authority's medical peer review process be reestablished, reaffirmed, and strictly adhered to, as provided pursuant to applicable federal law, rules, and regulations, and as further provided pursuant to the standards and processes duly adopted by the hospital and the American Medical Association relative to the procedures and practices for the conduct of medical peer reviews. The committee did receive written testimony from the hospital, from Mr. Verga, who has indicated he was unable to attend this morning's hearing. We also are awaiting additional testimonies from the medical community, and so all those will be submitted and incorporated into the committee report. So being that we don't have anyone here testifying on Bill 275, I'd like to ask my colleagues if they have any comments or questions they'd like to proffer at this time. Senator?
Just, I guess, an observation, Mr. Chairman. We do know that a good number of our medical professionals are busy at work at the moment, so I hope that perhaps a representative would be able to provide some written testimony subsequent to this hearing, because it's always good that as we apply the review of their peers and some of the decisions or proposals that are recommended from the peer review process, that certainly we hear from them in terms of moving forward with this legislation. But I think it does hit a note in terms of making sure that there are some procedures and some processes in place that are going to be recognized as it applies to the medical field. So I certainly do hope and anticipate that there will be some written testimony subsequent to this hearing. Thank you very much, Mr. Chairman.
Thank you, Senator Uggan. And yes, for the record, the committee has extensively had discussions, extensive discussions with medical professionals who are at the hospital. And it's also the committee's understanding that because of an incident and because of what has transpired during the oversight hearings of the last term, there may be, a hold on peer review that's happening in certain departments of the hospital. And so I say that without elaborating, because there is no one here from the hospital to be able to speak on that. So we'll leave it at that. We'll leave the record open, but the intent of the committee is to move this forward, as we know that it's important to, of course, number one, again, protect the sanctity of the medical peer review process, and also to protect the patients that do come into our hospital. Thank you. So this now concludes the public hearing on Bill 275-32, and for individuals who wish to provide testimony, they may do so by submitting written testimonies to our office or delivered here at the Guam Legislature. Next on the agenda is the executive appointment of Mr. Valentino G. Perez as a general member of the Guam Memorial Hospital Authority Board of Trustees. And the term of appointment here, as indicated by the governor, is 6 years. And so now we do have the appointee present here. I'd like to invite him up. Good Mr. Perez.
Good
First
morning,
of all,
Senator.
thank you very much for being here. Congratulations on your appointment. Um, we do have your packet, and so if you'd like to make an opening statement or brief remarks, we'll welcome that at this point.
Absolutely. Thank you for having me in front of you. It's, to me, quite an honor to actually be appointed to the board. My purpose for looking for employment or accepting it was that I wanted to just help the hospital. I know some of the board members. I know the operations that have been going through, especially in the public eye. And I was told that we are short some board members. We're having a hard time filling those slots. And with that, because we've got not a full slate of board members, sometimes we go through some periods where we don't have board meetings for the hospital. I'm looking to help fill that slot so that at least we may make quorum and then hopefully help out with some operational and finance expertise on my side to help make some sound decisions.
Thank you very much.
Thanks.
Senator Uggan, do you have any questions?
Thank you very much, Mr. Chairman. And Mr. Perez, I also would like to echo the sentiments of the good chair in terms of accepting this particular appointment and stepping forward. I think that perhaps the Guam Memorial Hospital may be one of the most challenging government entities to work for and to serve the people of Guam in over the course of the next 3 to 5 years. And I say that understanding full well that not only does GMH continue to undergo some financial challenges on a daily basis, because I also highlight that the opening of the Guam Medical Facility, that brand new hospital, is certainly going to have an impact in terms of the operations of GMH. The question is, what type of impact, and how can we continue to ensure that that public hospital facility operates for the benefit of the community and the people of Guam who otherwise would not avail themselves of going to the neighbor brand new facility. So, I mean, I think that that's an issue that's going to be discussed extensively over the course of the next year and a half. And I certainly hope that you will monitor not only the finances, because you bring a financial background and perspective to GMH. So that's going to be extremely helpful in terms of monitoring where the resources are originating from, what the collectibles are, what the accounts receivables are, and how GMH is pursuing some of those much needed funds, but also monitoring the activities and the impact of the operations as a result of the brand new partner that's going to be opening up, if not at the end of this year, early next year. So I thank you again for stepping forward and extending yourself to the community of Guam, and I certainly look forward to your service on that particular board. Thank you, Mr. Perez. Thank you, Mr. Chairman.
Thank you.
Thank you, Senator. Senator McCready?
Thank you, Mr. Chairman, and I want to thank my other colleague, Senator Uggan, as well. And I share the same sentiments as them. I look at you, and I was talking to you earlier before the hearing, and this is your first time. And but I don't think that's a bad thing. I think infusion of new energy and new ideas is a great thing. I thank you for accepting this nomination for 6 years, and you're absolutely right. There's a void. There's a gap that we need to fill with not just the hospital, but there's a lot of board members that we need to fill. Hospital is probably the toughest one because it's not the easiest job or a board member to make those tough decisions. And I look at your background and your packet, and you're very qualified to do this job. And you know, it's an honor for you, but it's an honor for us to get people who are qualified, who have a vision and a financial background that can maybe lead this hospital in the right direction. So I really don't have any questions, but maybe just one. Have you seen the financial sheets of the hospital?
I have. Sorry about that. Even over last year, I've looked over the financial statements. I was interested in the hospital and how it was working. My biggest problem with this position, and not just me, but for any board member and for Guam and the government, is knowing the challenges that the new hospital pose. One of the biggest problems with the hospital is that we get patients in there that can't pay, right? We know that. We know that's just a given. But as a financial advisor, even as a personal financial advisor, I used to tell my clients, hey, you know, if you want this, you want more than you've got, you got to do one of two things: either make more money or spend less. There's no way around it. It's basic budgeting. And in looking at the financials, I know they've got a problem, but we're also a community hospital in which we can't turn away a single patient. So we've you've got two issues at hand that we're trying to make them independent and self-sufficient, or we'd like for them to be so. But it's darn near impossible just because we can't turn anybody away. The beauty about any other non-community hospital, and including the new hospital coming up, is that they're able to. They can pick and choose their clients and make sure that they pay because they're going to go after the insurers. So, for me, it's just a no-win situation for the hospital. But in trying to help it out and see if we can make it better and make them a little more self-sufficient, and knowing that the new hospital is going to be coming up, there's some big operational issues because if we do lose some of the clientele, let's just say I'm sorry for using instead of patients, I'll use clientele because they are the customer. Let's say you lose half of the customers of GMH. You've got a massive building with a lot of square footage and a lot of volume, full of air that you need to air condition. The operational numbers are still going to stay the same because you have to staff it accordingly. But if you don't have that many patients coming in to provide the revenue, where do they go? Where does the hospital go? And I want to help. I've spoken to Mr. Ulrich, Mr. Varga, and I think highly of them. I think they genuinely want to do the best that they can, and they're trying their best. It's just sometimes it may be hard for them to do so. But being able to see how things are run on the inside as well and report that and help make decisions on that, I'm hoping I can help. I'm not saying that, I've got the answers. I most definitely don't. But bringing in a perspective from just another side, a non-medical perspective, I hope that I can. And on the medical side, I've got two brothers who are both doctors, and I kind of see the way they think. But working over at FHP Clinic, I know how providers think as well there and what they're supposed to do as far as caring for the patients. So regarding the financials, yes, I have. It's kind of scary.
I just wanted to ask just a follow-up question, if I may,
Sure.
Mr. Chairman. You said that you would either raise the revenue generation or cut, right? Obviously, that's the core of a business.
In budgeting, absolutely.
How would you raise it, and what would you cut?
Well, that's a hard question
It's
or
a
to
tough
answer,
question,
just because
yeah.
I don't truly know the operations, the current operations of the hospital. But I was more talking on a personal basis. When I have customers who say they also want a boat, they want a motorcycle, they're going to send their kids to college, and yet they're working off of $50,000 a year, and they have a mortgage to pay on their brand new home. It's hard to fund all those things.
Yeah.
So you want less, spend less to fund more, or you just say you want less, or you make more money. With that respect, making more money for the hospital, you get more patients, right? Well, that's the billing side. You can bill all that revenue. Collecting the revenue is a very different story. We all know that. Anybody's had a business, or anybody's used a credit card. You buy it. There you go.
Yeah.
Sometimes that credit card company collecting the money owed, it's sometimes easier said than done. Cutting operations, I don't know, and I don't want to really guess on that one at the moment. But if you look at what is a priority and what needs to be staffed, what operating machines that may cost a lot of money or use up a lot of power, if we're not using them, let's just think proactively and try to minimize the usage. But if a patient comes in, they need it, absolutely, you got to do it. That's just what we do.
Thank you, Mr. Chair, and Valentino, thank you. You have my full support, and congratulations and good luck.
Thank you very much. I appreciate that.
Thank you, Senator. And thank you again, Mr. Perez. Just to follow up a little bit of what Senator McCready had asked, I know your background is along finance, and that's a big plus for us in the hospital. In the past year, you said you've looked at the finances maybe for the past year.
Yeah.
Where do you see the holes at there? I mean, you've said it already. It's the collectibles. We know some of the people that we treat there will never be able to pay, right? But do you see any bright spots where if we clean up and fix up what we need to, where there's potential? Have you looked at that?
It's hard to delve fully into the details of a financial statement if you don't have on the corporate side. For publicly traded companies, you have something called an MD&A, management discussion analysis, along with their annual statement and filing. Without having something as detailed as that, but yet without being able to also go into the software, the computer system that shows what's going hard to find holes. Um, but what I've noticed is, we continue to take in patients, so there's going to be some expenditures, right? We have expenses. Every time somebody comes in, um, be it not just the personnel involved, but they've got to cut. You're taking out sheets, brand new sheets to put on an exam table. You're pulling out gauze bandages. Uh, those items cost money, and when you can't get the build revenue collected to cover those funds, it just makes it extremely difficult. Um, the hole isn't necessarily a hole in the financials in the way the hospital is run, because if you look at the premise on which the hospital is run, they service Guam, they service the outlying islands. Their purpose is to make sure we provide treatment, medical treatment, to anybody that comes in. That's the priority. Secondary priority is, okay, let's hope it can fund itself. But with the priority being providing health care, everything else comes second. And when you take people in that, if you were a for-profit hospital, wouldn't pay, then you turn them away. Um, so the biggest hole I find is not with the operational hospital. It's probably more of the intent of the hospital. And I'm all for continuing to provide medical care to anybody who needs it. So that is the focus of the hospital. It's being able to collect those funds. Um, I'm not a politician. I'm not a rule maker. And so however we get that funding, we rely on you. That burden, that task falls on you folks, because we still need to keep that hospital open. But if we have to go for um, funds from the feds, if we have to take it away from another program, that's the harder decision. That's the stuff that would make me not sleep at night. And so, I leave that up to you. But that is the big issue. That is the hole in it.
Yeah, and I thank you for that. And we understand where, as a government hospital, we need to provide the subsidies, and we have, and this fiscal year budget alone, I think we've given more to the hospital, right? But the hospital, as well as an autonomous entity, must do its part to just like you said, there's two things: you either make more money or you cut operations.
Correct.
So the ball also is in the court of the hospital.
Sure,
and
absolutely.
So what I've been trying to stress and trying to get at from the hospital is, what can we do? What are the potentials still that we could do? Because there is a great potential. You have so much good people there,
Absolutely.
doctors and nurses and people that work there, and I don't think we've gone to the maximum to take advantage of the talent we have
Right.
there and the talent we have on island. So is that something that you're open to in expanding services, or what we have there now, in boosting their capabilities?
Well, you mentioned a couple of things for me that separate themselves out. As far as expanding services, that's probably something that we don't need to do. There are many clinics on the island that provide services in which they will not provide emergency room services, right? So we've got a lot of specialties on island, and having GMH bill for that, or at least open that up, might be Pandora's box. Just because we, once again, might fall into the same problem. We may not be able to collect on that revenue. As far as the operational side, you said we might be able to cut back on certain things. Well, for me, the priority and the first rule in any formula would be, at what level of care do we want to offer our residents for the island of Guam? And if we want to go off the metrics and benchmarks set by a certain U.S. county, state, city, or a hospital, and match those, well, we got to make sure that we can actually make it happen, that it is affordable. But in knowing the constraints, the financial constraints on which we do operate, because we have a very different dynamic and set of customers than any other state in the U.S., just is it possible? So if we want to look at what we can actually do, then an option, and I'm not advocating it. I'm just saying one option is you lower your standard of care. Is that something we want to do? I don't think so. Quite frankly, I want to make sure we have our standards of care where they need to be, and where as a resident, I'd want them to be. But it basically you're between a rock and a hard place. You keep that standard of care, or you let it slide. And I'm not for letting it slide, um, but you have to look at the picture overall, the big picture, and find out just what actually is possible. And that's something I want to help do. Like I said, I'm in healthcare now. I wasn't educated in healthcare. Um, I'm more on the finance side, but it's the operations side that I really want to help them do their job, because these folks know what they're doing. They've been doing it for a long time, and I wouldn't second guess anything they're doing medically. As far as the intent of working, that's a different story. But I'm not somebody's supervisor. We'll let management take care of that. It's more in helping them figure out what they can and can't do, and then try and help the hospital and the government interact so that we can come to some sort of middle ground in which it can happen.
Okay, Senator, you have anything else? Okay. Thank you again for being here,
Thanks.
and congratulate you. We'll keep your record open, and so people who wish to submit
Sure.
testimonies, they may do so through a written testimony and submit it to my office.
Appreciate
Okay.
it.
Thank you very much, sir. Appreciate it. We did conclude. Yes, we did conclude the hearing on 275. But I see Dr. Richardson here, so I would reopen it. And if you'd like to testify, I'll welcome you. Absolutely. Mr. Perez, you would like to? I think it would be good for you to stick around if you can. This is regarding the bill that we just heard earlier. Yeah. Okay. Okay. Please. Anywhere. Dr. Richards, if you can just state your name for the record so we have it on.
Ian Richardson, and I work at GMH. I'm a doctor at GMH. I'm vice chairman of the ER, and I'm vice president of the medical staff, both of which positions are elected, voluntary, and unpaid. And that's kind of crucial for how the hospital works. And one of the fascinating things that Mr. Perez is saying, which of how we make these arrangements to make the hospital run, is how we function within the of laws and the finances of the country. And I keep hearing it said that we can turn patients away, that private hospitals can turn patients away. But if you accept $1 of Medicare, you cannot. I don't understand this. The law of the land is federal law. 60% of the finances in medical care in America are federal government. Nobody can function without, we spend, 18% of gross national product on medical care compared to 9% everywhere else, and 10% of it is Medicare and Medicaid. So what really fascinates with the new hospital opening is that, exactly as you say, when half of the patients disappear, i.e. all of the paying patients, how does GMH remain any kind of viable operation? And what I don't understand, and the chair and I have discussed it, and I understand there are legal reasons why it happens. Any other community I've worked in, government agencies distribute scarce resources, and they allocate resources where they see that the community needs it. So I trained in New York, and I spent years working in New York. And, the Medical Oversight Committee there establishes each year how many beds will we pay for in psychiatry, how many will we pay for in surgery, and they allocate it to each hospital according to the Medicare payments, how much they're going to get. So there's always oversight. So the astonishing and terrifying thing to me is that our community seems to be allowing a new hospital saying, we're for profit, we're going to take all of your paying patients, but we don't feel any duty to comply with the overall requirement of first of all, thanks a lot for helping us with this. I've always worked in public hospitals. It's what I like. I love the idea of a hospital that sees everyone. So it's just, what I grew up with and what I like. And so this issue of peer review. Peer review, what it is not really obvious to people. I know when I finished medical school, I didn't know what it was. I heard about it, I kind of seen it, but I didn't understand it. It's only when I've been working for a few years that you realize the only thing that gives patients safety is peer review. If you wait for something to go wrong and for lawsuits, it's kind of too late. Peer review is basically, it's a collegiate thing. It's not done for punishment. That's the licensing board. It's done so there's constant, ongoing oversight of all medical care by the only people that really understand it. That's the other people with the same training doing the same job. And the reason that it's really not done for punishment is you want people to be involved. You want people to be able to come forward. If they feel a weakness, if you see a mistake somewhere else, it's hard to come point the finger at someone if you think they're going to get punished. It's hard. In medicine, so what peer review is to avoid that problem. If you see a problem, you take it to your department, you do peer review, but it's not accusatory. And we've always done peer review at GMH. Always. Always. And what normally happens, if there's a problem, we discuss it, we try to figure out why did it happen, and mostly we look, how do we stop it happening again? It's always the goal. And that comes down to more education, proctoring. We have to do proctoring. Maybe needing more training. Very unusually does peer review turn out to be something that requires punishment. Very unusually. 99% of the time, the peers discuss it, you see a problem, you find a solution, and the person that was involved in the problem feels bad about it. Sometimes they feel terrible about it. They want to do something better, and it works out. Occasionally, it doesn't work that way, and you end up in things that become issues of punishment. With the, I'm not sure, Mr. Chair, what happened with that section 3-2 in the law, because peer review has nothing to do with licensing. Nothing at all. In the US, most jurisdictions allow you to have a license after 1 year of training, after you've done an internship. But no hospital anywhere will give you privileges with 1 year of training. So licensing is sort of a very low baseline, and it's where things go if they become a problem. But it's nothing to do with peer review. And in the States, licensing bodies are paid, they're professional, they have special training, they have lawyers specialized in medical law, they have investigation teams. It's a pretty big operation. For us, it's voluntary, it's politically appointed, it has a minimal staff, and so the issue of confusing licensing with peer review, I think, will be a major problem, because our licensing board doesn't have anywhere near the capacity to do peer review, which requires that you have all these other resources. Well, just to conclude on what peer review is, in order to get privileges in a hospital, it's mandatory that you participate in peer review. You can't keep your privileges if you don't participate in peer review. And basically, it's this constant routine oversight of anything that goes on. Now, GMH always did peer review. We did it every single month in every department until a year ago. And since a year ago, we've done none. It ceased occurring because a kind of bizarre, a fairly dramatic event happened in which the Board of Trustees and the administration manipulated the peer review process on behalf of the party. And they overturned, well, actually, I shouldn't say they overturned, they threw out a peer review without even reviewing it, and did something that was simply criminal. They communicated with the National Practitioner Data Bank, which to doctors, we know if you lie to the National Practitioner Data Bank and get caught, you'll go to prison. It's a felony, you'll go to prison. Nobody does it. It's really bad. So our hospital administrator communicated with the National Practitioner Data Bank and misinformed them, misled them, and told them that the hospital had undone some peer review, which it never had. Never reviewed it. It was never even appealed. Since that happened, professional staff, the medical staff at GMH has tried every single month to get the administration and the Board of Trustees to overturn this thing and to support our peer review process. The reason we haven't done any peer review since that happened, because we were about to, we were immediately threatened with lawsuits. That the people we were going to do peer review said, how can you do it on me, but you don't do it on them? The only reason you're doing it on me is because I don't have friends in the governor's office. And we couldn't argue with it. It was true. So we couldn't do it. And we went back to the Board of Trustees. And we begged them. And we implored them. No way to force them. We made multiple unanimous votes, the medical staff at GMH, saying, we can't function if the Board of Trustees and the administration claim the right to overturn peer review whenever they feel like it. And the Board of Trustees has rejected this every single time. And the administration has rejected this every single time. Now, the only reason we still have accreditation at GMH, and losing accreditation will be a disaster, it's a Medicare equivalent. We have trouble getting Medicare accreditation. You walk around GMH, it's all these cracks. We normally have accreditation problems over the building before we get anywhere else. They take one look at the foundations and go, that's not right. But with accreditation, it's a Medicare equivalent, then we can continue to bill Medicare. Losing accreditation for us would be huge. We would have lost our accreditation at the last inspection because of this lack of peer review, because of this political manipulation of the peer review process. And essentially, the physicians did something sneaky. We simply hid and did not speak with the accrediting people. Now they're meant to come back, and we have a new president of the medical staff, and when he came in, Dr. Wen is a very professional guy, very above board. He said, this is awful. You can't do this. And he wrote to the accrediting body and said, will you help us? Because we can't get our hospital to participate and to follow the law. Will you help us? And they said, yes, we will. We'll send them a letter telling you, you will lose your accreditation if you do this. So we are at a state now, and we've reported this. The Board of Trustees, the administration, they don't care. We have been trying, the professional staff has been trying to get the Board of Trustees, Mr. Weber, and Mr. Berger to follow the law, and we cannot do it. And so the chair of this committee decided to put in a law simply to require them to follow the laws that exist. Not do anything unusual, as I understand it, Mr. Chairman. And we really appreciate that, and it's really crucial for us because we have failed in any kind of cooperative and normal practices to get to that position.
If you like to, yes. If you like to, Mr. Perez. Sure. Before we do that, though, Senator McCready, did you have any?
I just had one question. Is this the first time that you're speaking to these subjects and these problems? Is this something that has? Because I've never heard this before.
If I may, Dr. Richardson, this is, as I indicated earlier in the opening, was a result of committee hearings that happened during the last term. And so this was an issue that was ongoing, and you know, when Dr. Wen did come on board, it was brought again to our attention, the committee's attention. And so that's why we did move forward with this, because the fear we had was that there wasn't any peer review happening at the hospital. And from our understanding is that because there was this issue that was still pending out there, that if the non-medical board can overturn a peer review that's done by the medical staff, then that's where the pushback from doctors were. And so we did not want to continue that from happening. So we moved this forward to ensure that the sanctity of peer review is reaffirmed at the hospital.
The chair held, there were
Can we,
committee hearings held about a year ago, in which the whole issue of this overturning was discussed, and it was a committee that had a big turnout. I believe 12 senators were present, and really unanimously condemned and rejected the contract that the Board of Trustees and the administration signed in order to commit this overturning.
if I could, we'll limit the discussions to the subject of the bill, so that because we don't have the other parties here to be able to speak on that, so we'll limit it to the contents of the bill.
I guess a couple of questions. This peer review process. Now I'll speak from a finance point of view. Does it require any extra personnel costs? Any time for a doctor or physician?
Mr. Perez and Doc, we'll, if any testimony is to be had for the bill, we'll have that here. If there's any discussion regarding the whole process, we can do it outside the public hearing.
And so the bill itself is to mandate.
Is to protect the peer review process, so
Right.
that the board of trustees, which you would be serving in,
Right.
Cannot overturn a peer review process that's been done by medical professionals. And I think that's we do have maybe a file this thick that I'll be happy to share with you. We have
Not a problem. Not a problem. No, that's fine. So yes, I will alter my question, I guess.
Okay, and if you can direct the questions to the committee.
Oh, okay.
that'd be
Okay.
best.
Now, as far as the peer review process goes, in I guess in the corporate world and in most companies around the period, they've all heard of something called best practices, right? You go around and you look for what actually helps companies or organizations in a certain industry or sector be the best, the most proficient, the most efficient, and provide the best level of service. Is it my understanding then that even though there is a slight chance, proven by recent history and the numbers, that a peer review process may end up in some sort of punishment or penalty, that the majority of the cases in which peer review process reviews ends up with kind of a best practices nature, in which we say this is the way it should be done. You did it this way, not a problem. Moving forward, let's do this. Is that correct? Is
Yes.
that my
Well,
understanding?
that's what the good doctor has indicated earlier. Is that yes?
Okay.
Most
Okay.
of the time, when it sees a deviation from best practices, it implements some kind of corrective action to move towards best practices.
Okay.
And most
Okay.
of the time, because it's done in a cooperative manner, that seems to be an effective way to keep on the course of best practices. And occasionally, there will be disagreement, really occasionally, and then it needs to go to another step.
Okay.
And Dr. Richardson, just to ask a question, so when peer review is done, when is it reported to the National Practitioner Data Bank?
Oh, well, peer review, the reason that it doesn't cost any money to the hospital is it's mandatory as a condition of having privileges at the hospital. So any doctor that asks to have privileges, in order to keep them, you're obliged to participate in peer review. You're not paid for it, you have to do it. It's part of the responsibility. So the peer review process, it's all written out in the bylaws. We didn't invent anything new. We took it from other hospitals. It has a simple process. It goes from the department. If the department cannot resolve it easily in a successful and sort of positive manner, it is then referred to the medical staff, which is the overall body of all the doctors in the hospital, which goes to the medical executive committee, which is the chairman of the department and a couple of other people who will evaluate it. And in order for a problem peer review case to be concluded, it has to be reviewed by the medical executive committee, and the decision is made there. When that decision is completed, that is then reported to the board of trustees, and the board of trustees, by our bylaws, has the authority to either agree with it or send it back to the medical executive committee. They don't have the authority to throw it out.
So, when is it then reported?
So once it has gone to the board of trustees and they've made their decision, if they disagree with it, send it back to the MEC, and the process would continue. It wouldn't die. Eventually, it's either going to be rejected by the MEC or it's going to be accepted by the board of trustees. At the moment it's accepted by the board of trustees, it's then reported to the National Practitioner Data Bank.
Okay. And so what this bill does then is that when it is reported to the board of trustees, that they don't have the authority to overturn it. They must continue the process by bringing it back to the MEC.
In my reading of the bill, you have essentially taken parts of the federal legislation
That's
and
right.
simply stated out loud the fact that this is the law of Guam as well. That's my understanding.
That's right. That's
My
correct.
only quibble is that the law as it stands?
Yes, Yes, this is the bill, and we do have your concern that you did submit via email, and we also do have a written testimony from the hospital that has indicated the same sections that you're referring to. So the committee will do its work on it and make the necessary revisions if necessary, if needed. Okay, Mr. Perez, would you like to close up on this?
Yeah, basically just one point of clarification for me, and this may be a little premature, but just as somebody's very interested, uh, the peer review process has several steps, as you mentioned. It goes to the committee, to the board of trustees, then to the database. But in knowing that it is an equivalent of sorts to best practices, I just want to make sure I am very clear on this, that the peer review process, please correct me if I'm wrong. If anybody knows that I'm wrong, please let me know. But my understanding is that the peer review process is the medical industry, being the medical professionals, doctors, nurses, everybody, telling doctors how to be doctors and provide service, or not necessarily telling them, but making sure it's done the right way. Would that be better?
Yes. Yeah. But it is a requirement of being a doctor in anything other than in a private clinic.
Okay.
So anytime you work essentially in the public realm, as part of your professional ethic, and this even is aside from licensing, although licensing always agrees with this. So the licensing of a doctor always says you are held to the medical ethics of the American Medical,
Yeah,
so that's
absolutely.
how it's tied in.
Okay.
So it's not something that's optional for physicians
Okay.
to do peer review. No institution in America would allow a physician, and it would be simply stated in the bylaws, and it's stated in our bylaws, you can't have privileges here except that you participate in peer review. And the reason for it, and then it's tied very tightly to this National Practitioner Data Bank, and that's about 20 years old because of a couple of nightmare cases where it was recognized that only really your peers can understand if you're doing something wrong. And it is absolutely tied to maintaining best practices, and when deviations from best practices occur, to make corrective actions that will go back in that path. And the reason that it is meant to be non-accusatory and not aiming at punishment was really a realistic appreciation that if you make it accusatory, people will hide.
Of course.
And you won't get what you're aiming for, which is to help those guys lying to beds.
Right. Absolutely.
Okay. So,
good.
Senator, really, Senator Ogden, if there's nothing else, then we'll now conclude this public hearing again for 275. But keep it open for any additional testimonies that the public may wish to submit. Thank you very much. It is now 9:45. We're adjourned.